Hello, Apala community, and welcome to this short video where we're going to discuss research impact. For most of us, when we're doing research, our aim is to publish our data in a peer-reviewed journal. But this is actually only where the journey begins. And so to discuss this further today, it's my great pleasure to introduce Ken Knight. Ken, thanks for joining me today.
Thank you, Sarah.
And Ken is an expert on many, many things. Three of those things that's worth mentioning now is that he's an expert on research impact, implementation, and also knowledge translation. So Ken, can you tell us a little bit about your background and how you became interested in these areas?
Thank you, Sarath, and thank you for the invitation to come and talk today and to the Apala community. So I'm Research Impact Manager here at the Murdoch Children's Research Institute and across the Melbourne Children's Campus. And I'm also chair of the Australian Association of Medical Research Institutes Impact Working Group. And in those two roles, I really lead a program of capacity building and culture change to enable research impact. And I started this work maybe about 12 years ago working for the Australian government as a researcher, but because I'd come with somewhat diverse research experience, I moved into knowledge translation, which effectively is about getting research evidence into action, and the rest is history.
Oh, fantastic. So could you tell us what research impact actually is or means?
Yep, brilliant. So research impact at its heart refers to the changes or the benefits arising from research findings or research activities. There are lots of definitions of research impact around, but that is it in a nutshell. Most definitions of research impact will break impact down into a number of subcategories because we're talking about a really big concept here. One of the categories or one of the ways of breaking that down that I particularly like is provided by the Canadian Academy of Health Sciences. And they think about impact in 6 key areas. And this is specifically impact in health and medical research. The first is around contributions to knowledge. So what did we learn as a result of our research? What knowledge was generated? The second is research capacity building. So how did we improve our ability to undertake research? What skills were generated? What innovative methodologies or infrastructure was developed? Then there's decision making. So how were decisions or how might decisions be informed by our evidence at every level of society, from other researchers through to community members, through to government policy. Then there's health impact, so improvements in health and health systems. Then there's economic impact, so cost savings, efficiencies, and income arising from research. And then broader social impacts, so participation, equity, and determinants of health.
I must confess that this is a new way of thinking about research outputs for myself, and I'm sure for many of the Apala community. So could you just let us know whether or not you think that this is relevant to those of us in different research settings or in countries that may have different levels of resourcing for research conduct?
I think it's a really important question. And I think I like to bring things back to that Stoic philosophy of, we can only really do what we can, where we are, with what we have. And so I think a thorough and rigorous and appropriate assessment of our challenges, our needs, and the resources that we have to affect change are fundamental to any kind of conversation around research impact. So I think another thing that we need to talk about is the why of research impact. And so the why will be relevant whether you're in a low resource setting or whether you're in a first world setting. And I think for me in Australia and globally, we respond to 4 key challenges when we think about research impact. And those key challenges are, well, the first key challenge is one around time lags. We know that it takes a very long time, and some estimates place that at 17 years to move policy and clinically relevant research into action. That is linked to the second challenge, which is research waste or underutilization. And some credible estimates place waste or underutilization in research, in health and medical research, at up to 85%. Now, these are huge challenges that we face. So despite the investment in research, we know that research doesn't often get out of the journal or get out of the data set or out of the research institution. The clinical implications of that are manifold and unsurprising, but two that I'd like to think about are we know that there is an underutilization of effective treatments and an overutilization of ineffective treatments within our health systems. And so I think we need to think about mobilizing our resources to address what are four very serious challenges that affect health and well-being, not only in high resource settings, but in settings everywhere. But I think to your point around, where the focus needs to be, I think a key question for any researcher who's looking at kind of making some kind of difference out of their research is, what is the key need that my research responds to? What are the opportunities for me to respond to that key need? And then based on my resources and based on my setting, what's feasible and realistic? And I think it's perfectly appropriate to start small and to iterate. And I think that that's also just the nature of research in general. Individual researchers and individual research projects are rarely going to address or change or resolve what can be and what often are key challenges in healthcare.
A fundamental point in what you said there, which resonates with me, is that concept of wastage of research, that such a high proportion of it doesn't really change patient care or change policy or government policy. And therefore, I would suspect that in a low resource or low income setting, it's actually increasingly important to try and make sure that the research that you do is actually effective. So I can see that there's certainly some relevance to anyone in any setting. So thanks for actually alerting to me to this slightly different way of thinking about research. So what are the practical steps? When should you think about research impact when you're commencing a research project? And how do you think about it?
Yeah, it's kind of the excellent kind of question that everyone asks me, is the what works for impact. And I think my always frustrating response is, well, look, it depends, because what we're actually asking, or what we need to ask in addition to what works, is what is likely to work and be effective in this context for this particular group or cohort or population with these constraints. And so we're really talking about complex systems and systems change here. Despite that, though, I think we have a range of evidence-informed processes and steps that will make impact more likely. The first one is begin with the end in mind. And by saying that, we mean be very clear from the beginning about what need or challenge or problem our research questions and processes address, and have at least a rough idea about the destination or the potential for change that our research question and process will likely lead to. Second is use program logic or theory of change to conceptualize your research program, to embed assessment into your research activities, and to clarify how you think change will occur. And if theory of change or program logic is a new concept, we have a range of resources that we can direct people to think about building that into their program. Thirdly, and very importantly, I would say we need to engage and involve our stakeholders, our beneficiaries, all of the various other non-researchers or non-clinicians we work with or serve to benefit from our research activities in our research processes. All of the evidence suggests that by being more inclusive in our research processes, by co-producing knowledge and co-designing our research, it will mean that our research is more relevant, is more timely, and has more likelihood of being adopted by different stakeholders.
I think that answer, Ken, alerts me to our concept that research is not an individual pursuit. It is a team pursuit. And in fact, you're talking there of extending that team into the community. So you're actually thinking about what's the end result right at the outset. So you're talking about this really at the point where you're thinking about the research question itself.
Definitely.
Absolutely fascinating. Did this evolve directly from the sort of research community, or are there examples of this sort of impact that have applied in business or other areas that we're actually borrowing from here?
Well, I think that's also a fascinating question. And I think that this is a field that has been evolving over a number of decades. My fourth kind of evidence-informed, I guess, approach to enabling impact is to draw upon the relevant theories and frameworks that we have to navigate as a kind of a map and compass what can be tricky terrain. And so I think theories and frameworks, including knowledge translation, implementation science, quality improvement, and impact and evaluation, are there to really guide us in our efforts. And these have been developed collaboratively, multidisciplinary, in a multidisciplinary way over a number of different years. And so I think that there is a rich evidence base to guide us in all of this work.
Well, thanks, Ken. That was really, really interesting. For many of us, you were describing a new concept and a new way of thinking about research impact for us, way beyond just getting our data published in the journal, and a very important new concept that I think everyone in a parlour would appreciate. And hopefully we can develop the resources to share alongside this talk for all of you listening. Thanks very much.